WHOW mobile app. Plus, hear a best of Clinton sports broadcast Saturday mornings at 10. All brought to you by Love It Once More Thrift Store. Keith Wade, your country financial representative, and our exclusive sponsor for our player of the game, Serve Pro of Piatt, DeWitt counties, the leader in cleaning, restoration, and construction.
Your friend in Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest on the phone today is Tony Kirkman, Executive Director of the Piatt County Mental Health Center. Tony, how are you, sir?
I'm well, Mr. Seth. How are you?
Doing good. Thanks for asking. Thanks for making time for us. As always, it's good to have you on the program this morning. And, of course, Tony, as we work our way through the spring legislative session in Springfield, so many entities are keeping an eye out on what's happening in Springfield, including yourselves there at the Piatt County Mental Health Center and you and your peers in the world of mental and emotional wellness and those sorts of things. So let's dive into that, Tony. There's a lot on the table in Springfield. It sounds like that you're keeping an eye on. Where do we start today? What's top of mind for you in Springfield right now?
Well, I would say one of the things that's not a huge ripple right now is legislators are talking about redefining some of the Mental Health Care Act, which helps provide language for 708 mental health boards. And so DeWitt County has a 708 mental health board, and a lot of their advocates are just trying to make sure that they have language that continues to allow them to function in the healthy ways that they do. At one point, there was some discussion about mental health dollars getting rerouted through the Illinois Sheriff's Association. And while I am a huge proponent of law enforcement and believe that mental health should be available through that system, I don't think that it should be taking the whole pie and carving it up and sending it through. It should be, in my opinion, really funded through the existing structures that are there and just learning how to enhance and how to make things more equitable. So that's not really all that attractive. A couple of the things that are interesting is that there is House Bill 2847 called the Mental Health and Wellness Act. And that's a really neat bill because what it is petitioning that private insurances must cover at least 2 mental health prevention visits by either visiting a behavioral health provider or their primary care physician for mental health prevention or wellness. And in the world that I deal in and most people are aware of is that, you know, insurance has a lot of rules. And one of those rules is if you're going to bill us, you need a diagnostic code. You need to be able to label it. This would allow us not to have to do those assessments, but really just kind of check in with the patient, help them address whatever stressors or things that are on their mind. And that doesn't require diagnostic code, and everybody still gets paid. So really hoping that gets a little bit of fruition or a little bit of push, because I think it would be very helpful for the overall mental health wellness. A couple other bills. One's called Louis Law. It's the official name is Drug Education and Youth Overdose Prevention Act. That's more of a petition that young people in elementary and secondary schools have annual access to the dangers of opioids, fentanyl, and understand the benefits of Narcan or naloxone distribution. So that seems to be gathering a lot of steam. One last one that's here in Illinois. There's a couple federal ones that we can talk about, but another one that's in Illinois that I'm watching is that the legislature just approved a pilot program for Chicago to begin what's called a safe site location. So that is where individuals can come into a facility that has the appropriate medical and security resources and will actually be able to use their substances most of them illegal, but being able to use those systems and would be observed and would make sure that their physical well-being is being looked after and hopefully prevent the risk of overdose or somebody taking advantage of them. And so that's very controversial. That we see a lot of that on the West Coast right now.
Yeah, I was going to say, I thought Oregon did something like that.
Yeah. But I will say, however we personally feel about it, statistically, the numbers are saying that nobody has overdosed in the safe site programs. And the numbers are showing that people are 30% more likely to enter voluntary substance use treatment after engaging in that. So, like I said, I know it's controversial. It's like you're going to allow somebody to come in and bring their illegal narcotics, and you're going to have medical teams actually showing them the proper ways to administer these illegal substances to their body. Yeah, I get it. But the other side of the coin is that you can't have a conversation about recovery with somebody that's passed away. So,
would that be a part of it? I mean, or is this just simply an enabling piece of legislation where it's, come here, do what you got to do. There's no conversation about recovery. It's just, do your thing. And when you've recovered in terms of, what do you call it? You're basically come off of whatever it is you're doing. You're on your way again. I mean, there's not that conversation about a long-term recovery and, why you're in the situation you're in and why you're doing the things you're doing. Does that make any sense?
No, I think it does. And again, I haven't seen enough about the program. I would hope that there are conversations about, our desire for you is to recover from your drug of choice. But what we're finding out is that, it's common knowledge. People don't like to be preached at or lectured, or, part of the addiction cycle is shame-based. So it's not like what they are doing is that they are unaware that it's unhealthy or even illegal. The message should be, we care for you. We think your life has value, and recovery doesn't necessarily require abstinence at this point. It's let's just take a bite out of the elephant. Let's just get you healthy. Let's start these conversations and let's walk you to a more healthier version of yourself.
Mm-hmm. Yeah, it like you said, it is a controversial piece, and I don't know. I just feel like we've backed our way into a corner, by enabling other behaviors and such. If that makes any sense.
Yeah, no, it does. And I briefly talked to you this morning right before we jumped on about the Piatt County Mental Health Center is struggling with that because we are a drug overdose prevention program that is very happy to provide naloxone or Narcan to anybody in either county. We provide a training and we distribute Narcan at absolutely no cost to anybody. So super, super happy to be able to do that. And understand that is like the very low rung of the harm reduction ladder. Safe site would be kind of towards the top there, but the way I look at it is Narcan is distributed normally by a loved one of somebody that's overdosed, and it's done after the fact. It's a reactionary method. The next one that we're really struggling with, Seth, is or maybe I am struggling with, is fentanyl test strips.
Yeah.
So these are strips that look pretty much like a pregnancy test, and individuals will crush up their substance, put it in diluted water, put the strip in, and it tests whether or not there's the presence of fentanyl or carfentanil in it. Mm-hmm. So that before they would use it, they would know whether or not they're dealing with something that's lethal. And I'm struggling.
Why are you struggling with that one?
Well, it's different. It's not reactionary. It's pre-action. I wonder, is the fear of not knowing what's in that illegal substance enough of a barrier for you to use it. Like, and I don't know. And so if I remove that risk, is that just, am I contributing to something that is hurting you?
Mm-hmm.
And that's, that I don't, I don't need to get on any moralistic high ground. It's just, I believe everybody has value. I believe that we are all created in the image of our Creator. And my job is to be encouraging and to care for my fellow brother or sister in the community. So if I am doing something that makes it easier for them to hurt themselves, I don't know how I feel about that. But on the other side of the conversation is, I've had people in the recovery community say, Tony, it's not about that. It's you are meeting them where they're at in their steps of recovery. And you just by the very nature of you handing them that strip communicates to them they have value and they're important to you, even if they don't use it at all. So I don't know.
Yeah.
I don't know where I'm at.
Yeah, it's and that's kind of the thing, is that a lot of this legislation is put together, without a I don't want to say a moral like authority, but you talk about how, we're accountable to our Creator and that sort of thing. It feels like we are embarking on a time in society where, we kind of view ourselves as not our own Creator, but that higher power. We are our own higher power, if that makes sense. Like it's a bigger conversation than just, legislation around Narcan and, test strips for fentanyl and things. But I mean, still.
Yeah, no, I agree. I think that, one is we meet people where they're at in their stage of recovery, but I have rarely seen people, and it can be done, but I've rarely seen people pull themselves out of that dark place of the disease of addiction outside of community. And so that's why, AA or NA or Al-Anon or Celebrate Recovery. That's why these are all important. It's because we want to pull you away from that shame cycle, and we want to let you know you're not alone. Like, we can do this together.
Mm-hmm. For sure. Tony, I'll tell you what, I look at the clock. We're a few minutes ahead of a break. Let's regroup and we'll come back and talk some more. Tony Kirkman, Executive Director of the Piatt County Mental Health Center, my guest on the phone. More to come with Tony on the WHOW Morning Show.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this Monday. Jim Taylor on the RFD Radio Network. We start the week in the green. Corn, beans, and wheat all trading higher. July corn, 596.5, up 10 1/4. September corn up 5.5, 516 1/4. And December new crop 514, up 5 1/4. July beans starting the day, 1407.5, up 17.5. August beans up 14 1/4, 1332.5. And November new crop 1234 3/4, up 11. July wheat 654 1/4, up 19 1/4. September wheat 666, up 18.5. And December wheat 682 1/4, up 18. July bean meal 439.70, that's up 680. And July bean oil on this Monday 49.80, up 28 cents. Opening numbers at the Chicago Board of Trade. Jim Taylor, RFD Radio Network.
If you think a new or used car is in your future, the time is now to call the Baum Chevrolet Buick sales team here in Clinton or Farmer City. This is Scott Baum. With a professional sales consultant in your corner, the vehicle search is easy. Meet with our sales team to go over your wants and needs. We'll start the search and do all the legwork for you. With so many models and options to choose from, we can help you get the information you need. BaumChevyBuick.com. Right from the start.
Hi, I'm Dave Jackson, owner of your Save-A-Lot store in downtown Clinton, here to talk to you about our great meat department. When buying meat for your family, ask yourself if it's cut fresh. Are the meat cutters in the store well trained? Our meat staff has over 100 years of combined experience. At your Clinton Save-A-Lot, we take pride in having the best meat department in the area. Plus, we'll save you as much as 40% or more on your total food bill. Experience what really fresh can be by shopping at your Clinton Save-A-Lot. Hope to see you soon.
Once again, a good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Tony Kirkman is the executive director of the Piatt County Mental Health Center, our guest on the phone here for today. And Tony, I know we've been talking about just things you're watching in Springfield as it relates to legislation and that sort of thing, and some legislation around counselors in school and some things happening and some direction towards targeting kids in need and those sorts of things in the school system. What's this all about? What are you looking at here?
Yeah, so I am really excited about this bill. It's called the Illinois School-Based Health Service Program. And so the Pritzker administration proposed to expand it to allow federal matching funds to provide services for students that are Medicaid enrolled to receive what they call critical youth mental health services. And just within the last 2 months, the Biden administration has approved that proposal. So I'm really excited to see now what ends up happening when you have the Centers for Medicaid, Medicare Services going to federally reimburse schools for what they're calling these critical youth mental health services. Now, I haven't seen what that completely identifies as what we're calling critical mental health services, or even how that is determined, if that's through an assessment or like what we see in IEPs or 504 plans. But having federal or access to federal funding to provide more behavioral health for schools is fantastic. So I'm really hoping that I can talk to our local administrators about the importance of working with a community mental health center and allowing us to partner together, because as you're aware, we provided a school therapist for 3.5 years to 3 different school districts in Piatt County, and the results were phenomenal. The issue that came out of it was, how do we financially sustain it? And quite frankly, the reason why it was being sustained was for the first 2 years, we covered the cost 100%. And then we started partnering on an aggregate with the local schools that they picked up a percentage of it. And it's needed. The problem I don't understand, Seth, with it is it's written for Medicaid eligible students. And I don't know how that's equitable. You're going to provide all of this behavioral health support for Medicaid eligible students, but those that aren't Medicaid eligible get nothing. That doesn't seem equitable to me. And I think the ACLU is going to eat it up. But the good news is there's money coming to schools that they can qualify for behavioral health.
Mm-hmm. Well, but we've also, Tony, I know last time you and I talked, you talk about that equity piece of this, but you've mentioned before, more affluent families seem to get access to better care and those sorts of things. Is there a correlation in those two thoughts, I guess?
Yeah, I think so. I think you're 100% onto it, Seth. I mean, if I have private insurance, I have my choice of therapists. I can go to any private insurance company because most of these private providers, they like the reimbursement rate. And so, yeah, they'll take them all day long. It's the Medicaid clients that either have a very poor reimbursement rate or they have a delay on their payment. And so these providers are like, I need access to a stable revenue stream. So I'm either not seeing Medicaid students or I'm going to cap it at mostly what I see is about 30%. 30% of my clients will be Medicaid eligible. Now, for your community mental health centers like ourselves and for Heritage Behavioral Health, we are not allowed to put that cap on. And so we are happy to serve everybody. But the reality is that by serving everybody, we have to accept a service rate that, quite frankly, doesn't even cover the cost of operation.
Right. That's how that goes oftentimes, too.
Yeah, and I think that's the problem is that, some people that are under-resourced have a lot of things that they're working for, and their needs are just as important as people with private insurance. I still have not figured out why the state of Illinois has not provided a reimbursement rate that allows me to pay my staff a reasonable living wage, and that we could really throw some resources out of transforming our community. But it does seem to be more of like the duct tape budget of just keep it going and managing an issue instead of fixing it.
I wonder, Tony, I thought part of the program you're speaking to where you had counselors in the schools there in Piatt County, I thought part of that was where you eventually had to make that a self-sustaining program. And so I wonder, if the state left it up to local people, whether it's county board, school boards, the 708 boards like you're talking about, if they left it up to those folks to work together, could that work?
Yes, absolutely. I think that if we could have created, quite frankly, if this bill would have been in action, we might have not had to discontinue that program. And we did. We worked out a way where, we launched a very radical program on a project, and I'm so thankful that the school boards agreed to come on. And it was a wonderful, transparent collaboration where we would bring back data so that the school boards felt more comfortable about financially partnering with us as well. And so, that's the thing. You want to work with a program that provides results. And so we kept showing more students being served on more difficult issues. And at least from our end, we thought it was a very harmonious partnership. And so it was working towards itself of trying to figure out how to cover the sustainability of it. But quite frankly, we all have increased expenses. And if we could have had the federal government come in and provide a match fund, that would have been a game changer.
For sure. Well, Tony, a few minutes yet here still with you. In fact, about a minute, just about. Let's wrap it up with just how folks find more about the Piatt County Mental Health Center. And we've got, as we go along through the summer, I know you've got some things that are coming to DeWitt County. We highlighted last month. You've got the Roscoe grant still going strong in Piatt County. Where do folks go to learn about all those things and the services for the Piatt County Mental Health Center?
Yeah, give me a call, 217-762-5371. Visit us online at piattmhc.org, or always check us out on Facebook. We have our main page. We have our Piatt County ROSC page. And starting July 1, we hit the ground running at DeWitt for DeWitt ROSC. And we'll be throwing up a social media page there real fast too. So would love to talk to your listeners and figure out ways that we can better collaborate and resource our community.
Tony, you're the best, my friend. It's always good to have you on the program. What'd you think of the Bears draft? They have a good draft, you think?
I'm feeling good about the Bears. Aaron Rodgers is gone, and I think we're going to have to. Kirk Cousins is going to fold up in the postseason, so I think all eyes are on the Lions right now to make sure that they just behave themselves.
Wow, what a change in scenery, right? Tony Kirkman, Executive Director of the Piatt County Mental Health Center, my guest on the phone. Network news on the way on the WHOW Morning Show, streaming to Facebook and YouTube. Brought to you by Peterson Insurance, your Pekin insurance agent in Clinton. Again, network news is now.
The Big 1520 WHOW Clinton, 92.3 FM W222 BG Clinton, 106.5 FM W293 DJ Normal Bloomington.
News this hour from townhall.com. I'm Rich Thomason. President Biden insists he's optimistic an unprecedented government debt default can be avoided.
There's still no agreement between Republicans and Democrats on increasing the nation's borrowing authority, but the president told reporters over the weekend that he remains hopeful a deal can be reached. Biden said he and congressional leaders will likely resume talks on Tuesday.
White House correspondent